And now, lastly, we'll be discussing about the different types of psychological therapies and the effect of different types of psychological therapies. So, let's begin with firstly, what are psychological therapies? Psychological therapies are sometimes referred to as talking therapies. Psychological therapy is a collaborative space to explore your difficulties in safe and confidential setting. So, the basic main aim of a psychological therapy is to help you better understand your feelings in the context of your past experiences. So during these therapies, people they're supposed to uh, uh, they're supposed to know how they're supposed to actually feel from the experiences from the past. So therapy provides a supportive, non-judgmental environment where you might feel more able to talk openly about your experiences. So what happens in a psychological therapy is you're assigned a certain therapist, and you will work together to make changes that you want to achieve to feel greater sense of happiness, empowerment, or perhaps to feel less affected by a particular experiences. So people suffering from psychiatric disorders, is generally consulted to a psychiatrist. So a psychiatrist, many of the main defect of the psychiatric disorders, which I could say is the main defect as well as the benefit of psychiatric disorders, is the absence of surgical treatment. So they need to be fixed within and by yourself by using therapies and love and affection, so and other medications. So the different types of therapies. So therapies can be individually with a therapist, meaning patient and the doctor, in a couple, or with members of the family. So in many of when it is associated with a child, in most of the cases it is along with the parents. So in order for the psychiatric child patient to feel safe and secure in a group of people with similar difficulties. Generally, there are gatherings in many places where people experiencing psychological problems come together, sit with the therapist sitting, the therapist sitting in between, and they explain the problems and tell them how they feel. So, firstly, let's discuss about the different types of psychological therapies. The first one being behavioral psychology or behavioral therapy. So, what is behavioral therapy? Behaviorism, also known as behavioral psychology, is a theory of learning based on the idea that all behaviors are acquired through conditioning. Okay, so conditioning occurs through. So, what is conditioning? Conditioning occurs through the interaction with the environment, meaning the people around you, different strangers, the people you know, people you don't know. So yeah. So a response to how they respond is called as conditioning. Behaviorists believe that our responses to environmental stimuli shape our actions. According to the school of thought, behavior can be studied in systematic and an observable manner regardless of internal mental states. According to the perspective, only observable behavior should be considered. Cognitions, emotions, and moods are far too subjective. Because emotions, moods, they're not constant. They vary from time to time or from situation to situation, obviously. So, strict behaviorists believe that any person can potentially be trained to perform any task regardless of genetic background, personality traits, and internal thoughts within the limits of their physical capability, obviously. You're not supposed to push the patients beyond the limits that might result in more damage. So, second type of theory is the cognitive theory. It is an approach to psychology that attempts to explain human behavior by understanding your thought processes. Let me explain it to you by giving an example. For example, a therapist is using principles of cognitive theory when she teaches you how to identify maladaptive thoughts of pattern and transform them into constructive one. So what happens in cognitive theory is your therapist, he suggests you to to channel all the negative energy into some sort of positive energy. So by doing this, what happens is the patient feels less insecure, He also learns to learn. He also learns to how to deal with the negativism. Also, yeah. Third type of psychological therapy is the humanistic therapy. It is a positive approach to psychotherapy that focuses on person's individual nature rather than characterizing groups of people with similar characteristics as having the same problems. Humanistic therapy looks at the whole person, not only forms the therapist's view, but not from the viewpoint of individuals observing their own behavior. The emphasis is on a person's positive traits and behaviors and the ability to use the person's instincts to find wisdom, growing, growth, healing, and fulfillment with themselves. So yeah, when is humanistic therapy supposed to be used? Humanistic therapy is used to treat depression, anxiety, panic disorders, personality disorders, schizophrenia, addiction, and relationship issues, including family relationships. People with low self-esteem, who are having trouble finding their purpose or reaching their true potential, who lack feeling of wholeness, like something or the other is missing from their life, who are searching for personal meaning, who are not comfortable with themselves as they are, may also benefit from humanistic therapy. Well, in today's world, most of the people are not really happy with who they are, and in my opinion, most of them are eligible for this type of therapy in order to discover themselves better, in order to accept themselves better, and live as a better person. So, what do you expect in a humanistic therapy? Humanistic therapy is talk therapy that encompasses a Gestalt approach, exploring how a person feels in the here and now, rather than trying to identify past events that led to these feelings. Additionally, the humanistic therapist provides an atmosphere of support, empathy, and trust that allows the individual to share their feelings without fear of judgment. The individual therapist does not act as an authority figure. Rather, the relationship between the client and the therapist is one of the equal. So basically, the trust relationship is what needs to be accomplished by the therapist. The patient shouldn't feel any sort of discomfort while talking to the therapist, because when he or she is fully comfortable with the therapist, then only they can express their thoughts fully, and then the therapist is able to detect what sort of the underlying psychiatric disease or the psychiatric problem the patient is facing, and in response to that, suitable therapy or a suitable medical treatment should be is assigned to the patient in order for better treatment and better survival of the patient. So yeah, that's it. Thank you.